Australian Rotary Health is a health promotion charity established by the Rotary Clubs of Australia. It raises funds for health research projects and scholarships, with a primary focus being mental health. It's supported by Rotarians throughout the country and is one of the largest non-government funders of mental illness research in Australia. One of our very successful fundraising events is Hat Day in October. 100% of the money raised goes into research for those affected by depression, anxiety, schizophrenia and many other illnesses. We're grateful for all donations, which are of course tax deductible. Faye Jackson is the CEO of Vision in Mind and Deputy Commissioner of the Mental Health Association of New South Wales. By speaking as a mental health consumer at public events, Faye has emphasised the potential of those living with mental illness being able to positively contribute in the workplace.
It's really difficult to get almost any support for mental health in the community, to have ready access to mental health in a timely manner, so that if the wheels start to become a little wobbly, you can go in and see somebody easily, you know, and get help quickly, so that the issue that you're having doesn't, you know, blow up in your face. I think that what's important is what you need, and that's not always about medication. That might just be about a safe home and, you know, enough food and a job and connection to family, you know, that kind of thing. They say over 1 in 5 people in any 12-month period has a mental health issue. So over the course of a lifetime, almost 50% of people will have a mental health issue at some point in their life. Rotary has been helping in profound ways. We've got so much to give, we just need the chance to give it, and Rotary gave me that beginning. Since being involved with Australian Rotary Health, I've always felt like I had something to offer them and my brothers and sisters of the community of people that have a lived experience of mental health issues. And so my work for them has really, at times, really kept me going, and it has given me the desire and the passion to get that word out to other people. It's a wonderful thing that they're doing. It's a wonderful thing.
James Charles received an Indigenous scholarship from Australian Rotary Health in 2002. Completely illiterate at 14, he turned his life around and in 2004 graduated as a podiatrist. He completed his Masters and is currently undertaking a PhD at Newcastle University.
What I'm researching is Aboriginal foot health. We're looking at, you know, obesity, diet, alcohol consumption, smoking, nerve function, blood flow. When I was at uni, I think in my first year, I'm not really sure how I actually found out about it, but I think it was just on a list of some of the scholarships that you could get. I was doing quite well and I was really motivated, enthusiastic. You know, I hadn't thought about any of these other things, but just to get through, you know, to become a podiatrist. I went along to meet my local Rotary club, which was Adelaide East at the time, and they were fantastic. Anyway, so I went along and I spoke, and that went really well, and then I got a Rotary scholarship, and that helped me to get through and become a podiatrist. And so then I got a scholarship to do my Masters as well. And that was a huge stepping stone for me to be able to do my PhD now and to do the research that I'm doing. I'm certainly very grateful and happy to, you know, give back in any way and that I can, in any little way. You know, it's allowed me to you know, help myself and my family and help my greater community, but also to serve as a bit of a mentor, or, you know, set an example. And you know, because I have to say that, you know, podiatry is not a glamorous profession, but it's definitely satisfying in that sense, you know.
Professor Jane Purkiss is one of Australia's leading experts in suicide prevention research. As Director of the Centre for Mental Health at the University of Melbourne, Jane has conducted a large number of evaluations into suicide prevention initiatives and mental health programs.
There is sometimes a perception that suicides are never reported, and there's also a perception that guidelines that have been developed to encourage responsible reporting are about censorship. but both of those things are actually not correct. So there is reporting of suicide. About probably 2% of Australia's suicides are reported. And the guidelines that are about responsible reporting of suicide are all about doing so in an appropriate way that's helpful, that educates the public, not in a way that runs the risk that people might copy suicidal acts. We were fortunate to get funding from Australian Rotary Health early on in the 2000s, in about 2001, and we did a project then that was a small project but an important project, which did indicate that this copycat phenomenon that I've been talking about exists. I think social media are like traditional media in the sense that there's the potential to do harm, but also the potential to do good. So I think the guidelines are still very relevant for traditional media. Social media is much harder because anyone can contribute to and consume social media. There's often discussion in the suicide prevention world about what the equivalent of those guidelines might be for social media. The funding from Australian Rotary Health was crucial in developing this whole area of research that really has become my own area of research since then. And I think there are probably multiple examples like mine where a modest amount of funding from Australian Rotary Health has spawned a huge area of research that has really advanced knowledge.
Betty Kitchener is the CEO of Mental Health First Aid Australia, a program which she co-founded with her husband, Professor Tony Jorm, and which is now in 21 countries. Betty's received numerous awards for her mental health work, including an Order of Australia medal.
I'm Betty Kitchener, the CEO of Mental Health First Aid Australia, which is a small charity that promotes mental health training for members of the public. So it's learning things that you don't learn in the regular first aid course, how to help someone who may be developing a mental health problem, how to help someone who's in mental health crises. So with some funding from Australian Rotary Health, we were able to really get as much evidence as possible to inform our curriculum, because there wasn't much research out there on what is the appropriate first aid for members of the public like you and I to help someone who's developing a mental health problem. And so we really came up with international guidelines with the funding from Australian Rotary Health to be able to say, yes, this is what you need to do. And because it was so evidence-based, it's now been adopted by over 21 countries. We now have over 220,000 adults in Australia have attended a mental health first aid course. So apart from the money we got from Australian Rotary Health to help with the guidelines quite a few years ago, we've also now got money to help research our teen mental health first aid program to make sure that we have it as good as possible and to make sure it does the best for young people.
Australian Rotary Health, working through research to make a better life for all Australians. Without your support, Australian Rotary Health wouldn't be able to support these inspiring and dedicated people.